Hello. So I had a request to talk about phobias. What are phobias? What causes them? This person noted that there's a lot of talk of anxiety, depression, but not so much this other stuff. So first, let's verify we all understand what a phobia is. So phobia is like a really deep, almost irrational fear of something. Um, it's more than just like high anxiety, but it is something you are consistently afraid of, and it disrupts your life. Um, if it's like you're afraid of driving in snow, but you live in Hawaii, like that's not really impacting you. That's not really a big deal. Um, so there are many different kinds of phobias, but they are broken down into different categories. So those categories include animals, natural environments, so that can be like storms, weather, heights, things like that. Blood, medical procedures or injuries, so people with like needle phobia, blood phobia, things like that. That's that category. There's situations, so like people that have fears of flying, driving, close spaces, so claustrophobia. And then there's another category for like people that are those weird ones that don't quite fit in the other one. So like clowns, choking, um, things like that. And so sometimes we can wonder what causes phobias. And so there's a couple different things that can cause them. Sometimes we can really like pinpoint what caused the phobia, and other times there's no clear explanation. And so you may have had a traumatic event as a child. Like if you were afraid of a dog, it might be because like you were attacked by a dog when you were younger. Um, there are certain ones that seem to be kind of genetic that evolutionarily this makes sense. So things like certain animals, possibly injury or situational phobias. Um, Though that one seems connected to also more learned phobias. So, like, if you were a kid and watched your parent have a phobia of driving or flying or snakes or something like that, I feel like it would be kind of hard to parse out or separate. Is that a genetic component, or is that because that was modeled for you and so you learned that those things were dangerous and that they're really, really scary? Um, And if you had a parent that was overreactive, that was really like protective of you or really freaked out when something happened that seemed way out of proportion to the situation, that again is going to have an impact on you. Um, and then there's informational transmission. So when we learn things or we hear things, that may influence us to also have that fear. So, what are symptoms of phobias? So, people get really scared, they get frightened, they may start to have a lot of physical reactions to that. So, their heart might start to pound, they may become sweaty, shaky, they may start to feel sick or nauseous, they may have trouble breathing or feel dizzy. Um, it's going to be similar to a panic attack, but we still have sort of a clear reason that this is happening inside of us. We may start to feel disconnected from our body or from the world around us. We may feel this overarching need to escape. And so those are things that can happen once we are um, faced with the thing that causes our phobia. And so they're diagnosed by a mental health professional, usually a psychologist or a psychiatrist, though like a social worker or someone like that can certainly do that. This is done through a conversation with you. There's no specific test or lab that can tell us, like, yes, this person has a phobia, no, they do not. But, we're going to ask things about history, about current symptoms, about how it impacts you. And so, like, if you have a fear of bridges, and so you change the way that you drive places so you avoid all bridges, that's going to be a sign that that phobia is happening for you. Or I had a professor in undergrad who, um, before going over the Mackinac Bridge, they would, try to act cool. But they would get out, say, "Oh, let's switch." But they would do that every time that they got to that point of their journey, moving between the lower and the upper peninsula. And so, how do we treat them? So, one of the main ways can be cognitive behavioral therapy with a really strong focus on the behavioral aspect. So, we can certainly look at trying to change your thoughts, and trying to look at those kind of irrational fears, work on challenging them. But the one that I think is most prevalent and is probably the most useful is exposure therapy. And so there's kind of two ways to do that. We're going to make a list of all the things that scare you connected to that. And so if you have a fear of dogs, the bottom may be just looking at pictures of dogs. And then it may be, standing a block away from a dog and then slowly moving closer over time to the point that, like, the top of the list would be a dog, you touching a dog or a dog sitting on you or something like that. And so the two ways to go about that is we can start at the bottom, start with sort of the easiest thing and work our way up. So that way you learn over time that, like, okay, this isn't so bad, this isn't so dangerous. Or we start at the top. And a lot of people are not going to pick that. That's like jumping in the deep end of the pool when you're not quite sure you can swim. But that is going to show, like, if it goes well, that you can handle it, that it's not as scary. Most people are going to pick from the bottom, starting with sort of the least scary thing and working themselves up. And depending what it is, these exposures may be what they say in vivo or in real life, or can be imaginal. We may start with imagining a dog, imagining standing close to a dog or touching a dog, and then work our ways to actually physically touching a dog in real life. Some medications can help, but I am a psychologist, and so that is not my area. I do not do medications. And so that's kind of the main things that I wanted to say. Some phobias, may fade over time as we get older. Again, we're getting some of that kind of corrective feedback that these things aren't as scary or as dangerous as we may have thought. And the only one that's a little bit different is like a needle phobia or a blood phobia, because those folks usually kind of pass out. And so that response treatment is going to be different because we don't want them to sort of relax too much. We want them to stay kind of in an active energy state. And so treatment does help. Treatment can help, but you have to stick it out. Part of what keeps the phobia going is this avoidance desire. So with anxiety and things based in kind of fear and anxiety, when we avoid, we turn away. That reinforces it, making it more difficult for us to kind of approach it in the future. Because when we turn away, we get all of this relief. And so it's like a dog with a treat. That relief is kind of our treat for turning away. And so if we try to push through, it gets harder each time that we've, how many times we've avoided. That makes it more difficult. And so if you know that is an issue, get help. You may know exactly what you need to do, but having somebody to help you walk through it, to hold you accountable, and to be with you through it is going to be really, really useful and impactful. And so that's just a little bit of what I wanted to say. If you have any questions or comments, certainly comment below. You can certainly also reach out on other social media platforms that I am on. All of my handles are the same, as well as my email at gmail.com. I hope you all have a lovely day and you do something nice for yourself. Bye.